You feel that your anxiety is caused by this and that might be so. It might be caused from stress, and you're having to deal with a new type of abnormality, and you have to take all these medications to stay alive, that you forget to be yourself. The one thing I found is that everybody that I've seen as far as patients, they're so good at being devoted as being a patient that they forget how to be a human, how to be themselves. You know all too well how to be a patient, but you forget how to be alive, that you forget how to be you. Because when somebody feels that they're a patient, they feel that every symptom of feeling out of breath to, a little increased work of breathing to, that's work of breathing, that's out of breath, but increase in heart rate, and things like that, people find that, okay, it's my disease causing that. That's a patient being a patient, right? That's a person being a patient. Versus you have somebody that understands that, okay, I'm going to go upstairs, or I'm going to go up this hill, or I'm going to walk a long distance, I'm going to be out of breath. But that's kind of normal because I'm a little out of shape. That's the person understanding that it's not their disease causing it, it's actually they're just a little out of shape. They know they're... What my point is that you have to understand that being a patient versus being a regular, Mary or Joe, just being an average person, or being not even an average person. I guess I'm being a little ambiguous. You forget to be you. You feel that your anxiety is caused by this and that might be so. It might be caused from stress, and you're having to deal with a new type of abnormality, and you have to take all these medications to stay alive, that you forget to be yourself. You forget that you are a human being, and human beings need a break sometimes. They need to find themselves. They have to understand their, what they can do, what they can't do. But you have to really it's really tough to get to know yourself. It's extremely difficult to get to know yourself. Like, your name. Like, your name. Like, I know my name is Alex. Okay? But who are you? Like, you forget who you are because you're a new person. You're a person that now has all these complications, and you have to kind of get to know that person. What makes you tick? What makes you irritated? We're talking about irritability. What makes you happy? Everything. But you pile too much onto yourself, it's just going to turn into quicksand. You pile too much upon, more and more and more. You can't move. You can't breathe. There's only so much you can. You can be the most benevolent person in the world, but you pile too much on, it's going to cause a lot of problems.